Hi everyone, my name is Dr. Courtney Bonato, and I'm going to just kick off my channel by telling you a little bit about myself and then explaining to you what my channel is about. So I'm a general practitioner in a small town called Bloemfontein in South Africa. I've had my own practice for about a year and a half. I studied at the University of the Free State for 6 years. I then did 2 years of internship at the 3 local public hospitals in Bloemfontein. This was quite an experience and it changed me tremendously. I then did my community service here in a small town called Kimberley at Kimberley Hospital. I then stayed on an extra year at Kimberley Hospital as a medical officer. I did both years in Kimberley in the Department of Urology. I learned a lot. I improved my clinical skills and my surgical skills very much, and I also did a lot of courses while I was there. So it made me quite a competent doctor and quite a confident doctor, and working in the public hospital in the public setting has taught me a lot, but I'm not going to delve too much into my time in the public hospitals. Now moving on to my channel. My channel's aim is to educate, so I'm going to be discussing an array of medical topics. I'm going to base the topics on what I see in my practice most often, what the latest medical issues are, and most importantly, what I see my patients have a hard time understanding. So today's topic is the big topic of the day, the thing that we're all sick of hearing about, the thing that I know I'm sick of hearing about, but I think it is important that we all have a basic understanding of the coronavirus or COVID-19. So the coronavirus or COVID-19 is a virus. What is a virus? A virus is an infective agent. It is so small that we cannot see it with the naked eye or even see it under normal light microscopes. A virus is unable to multiply by itself. It needs to be inside a host cell and use the host cell's DNA to multiply. In doing this, it causes damage to the host cell and can actually then cause death of that cell. So in the case of the coronavirus or COVID-19, it initially first was infecting animals. It then mutated or changed and is now able to infect humans. The host cells that the coronavirus infects in humans are the cells of the respiratory system. In other words, everything that you use to breathe, especially your lungs. That is why you get the symptoms that you do when you become infected with the virus. So why is it that some people get severely ill and die from the virus and others only get mildly ill or do not have any symptoms at all? So firstly, I want to just note that infants, children, and adolescents do not seem to be getting as ill from the virus, and we have no idea why. Okay, so the body's immune system is the body's defense system, and depending on how strong your defense system is, determines how your body will react to the virus, and this determines how ill you will become from the virus. So if you have a strong immunity or a strong defense system, once infected, you'll probably get a mild to severe flu. Your body starts to make antibodies. Antibodies are like soldiers that are specifically trained to kill that virus. These antibodies then go and kill that virus, and you should make a full recovery. These antibodies will be in your body forever. So it is suspected that if you do get infected with the coronavirus again in the future, these antibodies will go and kill that virus immediately, and it will then not make you ill, and you should not get ill again from the coronavirus. If, however, the coronavirus mutates or changes enough that these antibodies or soldiers are unable to recognize it anymore, you will then become sick when infected with the virus again. Okay. So if you have a weak immune system or a weak defense system, your body will not be able to defend itself adequately against the virus, and it will not be able to kill the virus. So what are some things that can cause you to have a weak immune system? Some of the most common things that can cause you to have a weak immune system are things like sugar diabetes or diabetes mellitus, obesity or being severely overweight, HIV and AIDS, TB, malnutrition, cancer, and being elderly. So how do you become infected with the virus? The virus is spread in the droplets that are expressed from the respiratory system when someone coughs, sneezes, and now it is even suspected that the droplets that are expressed when someone talks. So these virus-infected droplets that come out when an infected person does the aforementioned things, then goes into the air, lies on surfaces, can come into contact with people's hands, and can be inhaled by someone. So once that virus comes into contact with a non-infected person's respiratory system via these droplets, that person then becomes infected. You do not start to get symptoms immediately after being infected. This virus first needs to start multiplying, and your body needs to start making a response against the virus before you start to get symptoms. Symptoms can start anywhere from 5 to 14 days after being infected. So how do we prevent getting infected, or what can we do to decrease our risk of getting infected? Unfortunately, there is no surefire way of preventing getting infected from coronavirus, but there are a few basic things that we can do to prevent getting infected or decrease our risk of getting infected. So number 1, wash your hands with soap and water for at least 20 seconds. And you can also use hand sanitizer, which you spray on your hands. Make sure you get it all over your hands and allow it to dry naturally. This hand sanitizer has to be alcohol based, and it has to be at least 40% alcohol. By washing your hands or using hand sanitizer, you can kill any virus that may be present on your hands, and therefore you cannot transmit it to yourself when touching your nose, mouth or eyes. Stay away from people that are coughing or sneezing, or even better, stay away from people in general unless it is absolutely necessary. The less people you're in contact with, the less chance you have of contracting the virus. Wearing a mask can help. The virus itself is small enough to move through the fibers of basic surgical masks, fabric masks, FFP1 and FFP2 masks, but the droplets containing the virus cannot. Most of them cannot. So if an infected person wears a mask, the chances of them spreading it to other people is less, and also a mask is always a good reminder to not touch your face. Right. Also, if you do have to come in contact with people, these droplets that are expressed from sneezing, coughing or talking cannot travel further than 1 meter or 6 feet. Most of them can't. So by staying at least 6 feet or 1 meter away from anybody, you then can decrease your risk of contracting the virus. Right. So these are just a few basic things that you can do to prevent yourself from getting the virus. If you are ill and you suspect that you may have the virus, please stay at home. Do not go to your local hospital, do not go to your local doctor, and do not go to your local lab, because then you run the risk of infecting everybody on the way to these places and infecting everyone in your doctor's office, in the laboratory, or in the hospital. So please stay at home, phone your doctor, phone your local hospital, phone your local laboratory, and in most countries there is a coronavirus or COVID-19 hotline that you can phone, and they will advise you further on what you should do. Alright, so like I said, these are just a few very basic things that you can do to prevent getting infected. Also, what's very important is to keep yourself healthy, keep your body healthy. By doing this, you keep your immune system strong, so that if you are infected by the virus, your body has a good chance of being able to defend itself, and you have a good chance of making a full recovery. Alright, so there is no treatment available for this virus, and there is not yet an immunization available for the virus. So it is important to know that there are a lot of scientists and a lot of companies working on both. So what is treatment aimed at? Treatment is what we call supportive, meaning that what we do in patients that are ill is we support them and we treat their symptoms until the body eventually kills the virus off itself. So in mild to moderate cases, we would give normal medication that you would give to someone that has a cold or a flu. In more severe cases, the patient may need to be admitted to a hospital to get oxygen via face mask, and in very severe cases where the patient is unable to breathe adequately for themselves and unable to maintain the oxygen levels in their blood, we need to intubate them. So what we do is we put a tube into the windpipe. We then connect it to a machine called a ventilator, and this machine breathes on the patient's behalf. Okay, and in this case, these patients will then need to be admitted to the ICU. It is very, very important to understand that this is still very, very early stages of this disease and this virus, and the virus is not completely understood yet. So everything that I've told you now might change in the future once we have done more research on the virus. So This video was just to give you some very basic information, to give you a basic explanation of what the virus is. I hope that it was informative. I hope that you enjoyed it. I will see you guys in the next video. Please stay safe. See you soon. Bye.